I think the film's fascinating. I think the collaboration is brilliant, long overdue. I'm grateful for it. I have to start by just reflecting on two things, if I may. Firstly, Professor Richardson at the beginning talked about the word just. When I used to teach nurses, I used to do a section of an introductory lecture just based on the word just, on the nursing capacity to diminish the act of nursing, the exchange of care that it was. And at the beginning of a program like that, the nurses were very full of it. They thought, yes, this is never to be demeaned. But by the end of the course, they had lost contact on some level, or it had been culturally driven from them to actually value, firstly, what they did as being of social, cultural, and transcendent significance, but secondly, what it made them feel. And what I was always really interested in is, firstly, what it makes us feel, and secondly, what we do with those feelings, what happens to nurses as a consequence. Because for me, it's the whole thing's about embodiment. There's a line from Milton, I believe, where he talked about his experience, and he said he couldn't escape feeling. I don't think anyone can escape feeling. Certainly the nurses can't escape feeling. There is an element of nursing history, nursing culture, and nursing education, which tends to imagine that somehow, if you escape feeling, then you're a good nurse, you are being professional. It's a nonsense. It's philosophically absurd, and it's humanistically insulting to me. We don't escape feeling, we have feeling. What we often don't do is give name to those feelings. Nursing's not got a good tradition, in my view, of naming the feeling. Damasio, philosopher, talks about naming feelings as part of his Descartes' error, the book is. And he talks about if we name the feeling, it at least draws us towards interrogating it and trying to make meaning with it, and then maybe being able to work with it. It's really nice that people are talking about these things, because I think one of the reasons I stopped being involved with nursing is because I've been trying to talk about these things for years, and nobody cared. It was like the 100,000 you put on an ice cream. It's an added extra. It makes it look as though there's something humanistic going on, but it was lost. But art, and I thought it was very beautiful to watch the movement of the artists involved in the film. The thing that art does, it seems to me, is to try to make meaning. It interprets reality, it interprets human experience, and it represents it in a way that enhances our understanding of it. Nursing doesn't have a tradition of that. Nursing is a little bit shy, in my opinion, of looking for enhanced meaning, of developing a lexicon, if you like, that even thinks about those things. Nursing is the act of delivery, as it should be. But when you step away from the patient, the point where you think, well, let me interpret that, let me imagine what just happened, let me make meaning from it, isn't really available to us, partly because nurses are too tired, and partly because we don't have that academic history. What was very beautiful about watching this film was to actually see the making of meaning, the interpretation, the representation. We could learn a lot from that, I think. Well, I still say we. I'm not a nurse anymore. It's not my tribe. But still there's a we. Goodness knows what that's about. I'll think about that later. One thing I would notice, though, is when I'm giving them to you, when your artists recreate, represent, they do it with such grace and containment and control and interpretation and skill. And I don't think nursing has that available to it all of the time. You don't always get to hold grace. If you're crying because you're with somebody who is in pain, or you're failing to help, or your resources aren't available, or if you're angry because someone spat at you, or if you're despairing because you don't know what intervention to choose, those feelings lace the body and we lose our grace. We don't get to choose how to present. For 10 years, I used to teach. How do we hold ourselves? How do you go into a room? How do you occupy space? How do you hold the space in a way that enables the person who is most in distress in that? What is it? And I did it as a bloke who's 6'3" and has no hair. I did it because I had to reconstruct the way I was received by somebody who was vulnerable. And teaching that seemed to me to be vital to how nurses own space. If you're feeling loads of stuff, if anger or despair or exhaustion or shame, don't get me talking about nursing shame. We could have a cold conference about professional shame. any of that stuff is in our body. You don't get to choose the grace. You don't get to choose the beauty of movement that the dancers and the actors had. You drag it around with you. And in order to make something useful emerge from that, you have to interrogate it. And nursing doesn't have a language for that. It doesn't have a history for that. It can say it's got supervision. It can say it's got reflection. Those things are institutionalized liberalisms. They're not actually real to the everyday experience, particularly not at the moment when every nurse is exhausted. And I know of 2 hospitals where 2 nurses have killed themselves in the last 3 days. So there's something that is not available to us emotionally. There's something there about grace. There's something there about how we hold space. There's something there about how we get to choose how we hold space. But most importantly, there's something here in your work that allows us to reinterrogate what we failed to do for people I would still consider, when I think of my students, to be the best among us, people who have decided to lend us their heart or their energy or their beauty or their generosity, and that somehow we still collectively and culturally abandon. So thank you for at least asking some of the questions and for letting me ramble on a little bit. I think I should stop because that was quite rambly.